Good morning, Chicago. Today is Tuesday, May 3rd, 2022. Thank you so much for joining us. We got started a little late. We got wet coming over here, and I am ready for real spring from a weather perspective. But I do want to wish you a happy May, and May is Mental Health Awareness Month, if you were not aware of that. So I'm really pleased to have a special guest today. This is Matt Richards. He has been on before. He's our Deputy Commissioner for Behavioral Health at CDPH. And remind people sort of what is behavioral health, a little bit about your background. You'll have the opportunity to ask me questions about COVID, to ask questions of Matt or me about mental health issues, etc. But give people a little bit of background.
Yeah, thank you. Good to be on. So my name is Matt Richards. I'm a licensed clinical social worker. My background is in the treatment of mental illness and addiction and their co-occurrence. I oversee at the health department our mental health programs, our substance use and recovery programs, and our community safety programs. And excited to be on today and talk about May and everything that we've got planned.
Great, perfect. So as always, we will take a look at our COVID data. We have some slides for COVID updates, and then I actually asked Matt to bring just a few slides for some of the mental health work that is going on newly in the city. I know a lot of you have actually put in questions about what are we doing on mental health. When we think about COVID, we think not just about the direct impact of COVID, but the indirect impact of COVID. And obviously, we've seen big impacts on mental health. So thanks for joining. You'll be able to put the questions either directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. So we'll start with our dashboard, chi.gov/COVID-. And we continue to update this Monday through Friday every day. As you can see, we're averaging 709 cases per day right now, which is up 18% from a week ago. And I'll show you in a minute what that looks like in terms of rates per 100,000. We're at about 26 per 100,000. And hospitalizations are just about the lowest they have ever been. Just 12 Chicagoans being hospitalized with COVID a day. That's very good. And look at our deaths. We're averaging 0 COVID deaths a day right now. Isn't that something? It was, we are still seeing some Chicagoans die from COVID, 1, 2 a week. But really, this is nothing like prior increases. And this is mostly because of vaccine, as well as the fact that a lot of people who were not vaccinated have now seen COVID and have had some protection from that as well. You can see our positivity is at 3.9%, pretty stable from last week at 3.8%. So I'm going to move into these slides. And some of these a number of you had sent in some sort of unrelated questions, which we'll address. So first of all, a couple things from the news. I want to congratulate our team of epidemiologists at the Chicago Department of Public Health. Those of you who are still with us here on Facebook Live care about data. I know this. And so I was really pleased that our epidemiologists, our data scientists, were one of the awardees of the Chicago Mayor's Office Medal of Honor last week for their hard work and dedication to bettering the lives of Chicagoans. So we've got pictures of some of our epidemiologists across the different settings of the health department, and really want to give them congratulations. There's no way we could do anything, but especially this COVID response without them.
Hear, hear.
We also had a number of you writing in asking some pretty pointed questions about what might happen here in Chicago if Roe versus Wade were to be overturned, given that that preliminary decision that was leaked from the Supreme Court. And I brought this chart. I want you to know that we certainly have been watching this and paying attention to this in public health. Certainly, if we would expect that if Roe were to be overturned, we would see legal abortions fall. We would especially see that in the South and in the Midwest. And we expect that out-of-state travel as well as abortion pills would probably play a bigger role. Nothing would change related to access here, but we do expect, if you look at this map from the New York Times, this is showing the estimated decline by percentage that we would see in legal abortion. So the states that are colored and outlined in black are the states that pretty much right away, if Roe were to be overturned, there would not be access to legal abortion in those states, and all of the individual dots are where there are clinics that would close. So we would expect, most likely, given that Indiana, Missouri, and Michigan would all have less access, that we would see more people traveling over state lines here. So yes, we are certainly thinking about this and concerned, because we know that when there is not access comes to legal abortion, illegal and dangerous abortions that cause, serious health outcomes do go up. All right, on COVID. We are still seeing much higher rates of COVID across a lot of the world than we are in the U.S. Europe, parts of Asia, Australia, still very high. We're now at 67% of the world's population has had at least one dose of vaccine, going on 12 billion vaccinations, which is amazing. U.S. Looking quite good overall. You can see nationally we're averaging about 17 cases per 100,000. Illinois and Chicago both a little bit above that. And where we're seeing the most COVID cases being diagnosed right now is in the Northeast. You can see that's the darkest orange. Very few severe outcomes though. Like this is really that subvariant. And if you look across the different states and territories, you see Puerto Rico it actually is the highest still right now in terms of a little bit of a surging case rate. But nowhere are we seeing major points of concern or major alarm. Here in Chicago, you can see that increase in our case rates is more similar to what we saw with Alpha or with last summer, the initial Delta surge. Nothing like what we saw in Omicron, nothing like what we saw last winter, and not suggesting anything different there. And we are seeing a lot of first-time and very mild COVID infections. This is just showing the data. Our COVID hospitalizations have not been this low since last summer, and our deaths have never been this low. When we look at our updated variant surveillance, everything is still Omicron, and that is good news. We have not seen a new variant of concern emerge. That BA2 is 79% of what we're seeing, and then a subvariant even of that, the BA2.12.1, is now about 17%, and that subvariant is even a little more infectious again. And so if we look, this is sort of comparing across the whole US. That light pink is the BA2, and that red is the BA2.12. So you can see in the Northeast how they have more of that BA2.12. You can see ours is really relatively small, but because it's more contagious, I do think we will be continuing to see increases in cases probably for some time here until we see that subvariant become dominant. Our local risk based on CDC COVID-19 community levels remains low as of today. Reminder, low means we're seeing limited impact on the healthcare system, low levels of severe illness. We would get to a medium COVID-19 community level either with a significant increase in cases, over 200 cases per 100,000 over a week, or a noted impact on our health system. And to get to high, you have to both see a lot of cases and a big impact on the health system. So I do anticipate really probably this week or next, Chicago will move to that medium level. If we look at COVID levels by county, and especially if we zoom in on Illinois, DuPage County 2 weeks ago moved into that yellow or medium risk. Last week, Lake County did. And actually, suburban Cook County last week also reached that medium level, but Chicago's rate has been lower, so Cook County overall is still green. But given the increases that we're seeing, I do think Chicago will turn to yellow, if not this week, probably next. But still, overall, just 10% of the counties are in medium or high risk. And if you want to see the exact numbers, these are available on the dashboard. You can see right now we're at 183 per 100,000 in the last 7 days. Low is under 200. That's where we want to be. But Cook County, including suburban Cook, is all the way up to 190 because suburban Cook is in the 210s, 220s. And so I expect that all of Cook will probably be over 200 very soon. But the COVID admissions and the proportion of inpatient staff beds remain low. So just a reminder, when we're thinking both travel advisory as well as what that'll mean here, for anyone who's traveling to a county that is medium risk, we really recommend considering wearing a mask in indoor places. And if it's high risk, definitely you've got to wear a mask in the indoor places. And if you're not vaccinated, you really shouldn't go to an orange county. And if we put that in context for Chicago here, if and when we move to a medium risk, you will be seeing really stronger stronger recommendations around wearing masks indoors. You can continue to go to school and to work and ride the L, and you don't need to avoid gatherings. Certainly, if you are at higher risk for severe outcomes or live with someone who is, you may need to be more conservative. But really, for everybody, we'll be asking you to put masks on where you're in indoor settings, but only at high risk would that be when we would be requiring it in a legal mandated kind of way. We've been happy to see improvements in vaccinations. Black Chicagoans are most likely to be getting those first and second doses right now. And every day we're seeing hundreds of people get vaccinated and doing about 3,000 vaccines a day. Remember, there's lots of reasons that you will see someone choosing to wear a mask. For me, when we move into medium, I will then be wearing a mask indoors most of the time, especially in a setting where I don't know somebody's vaccine status. And so remember, there's lots of reasons. Be kind and respectful of people's choices. But if we move to medium, it's not like the sky is falling. It's not like major changes are coming, and we're not seeing a lot of severe illness. But we do want to try to put the brakes on in terms of just some of that transmission. Our vaccination Protect Chicago at Home program continues strong. As a reminder, we will bring vaccine to your house free of charge Saturday, Sunday, Monday, or Tuesday, morning, evening, or afternoon. And we'd love to keep getting Chicago vaccinated. So this is the number, 312-746-4835. As we expect to move into medium, we've also increased our surveillance testing for variants across the city. We've increased our wastewater. We're working to make sure that tests and vaccines remain widely available, including in higher risk communities. So if you need help with any of that, give us a call. All right, we're going to transition now to talk about some mental health, and then we'll get to your questions. So it is Mental Health Awareness Month, as I said, and we have heard you here in Chicago and across the country in terms of the major needs for more discussion of mental health, more access to mental health. We've already been making excellent strides here. And I am going to hand it over to Matt Richards to go through just a few slides, and then we'll get into some discussion and questions.
Great. Thank you, Dr. Arvedi. So you'll see, marketing like this. This is part of our Unspoken campaign. It's a campaign that's really about confronting stigma around mental health and encouraging people to tell their stories about their own mental health journeys, to be good listeners to other people, friends, family, neighbors, when they're sharing their stories of mental health, and to really make it easier for people to get connected to services when there's an unmet mental health need. When we think about what is mental health, we I think sometimes we use this phrase a lot, and yet I think sometimes we talk about mental health in very limiting ways. And what I mean by that is often when we say mental health, what we mean is just somebody does not have a mental illness. And at the health department, that's not actually what we mean. When we talk about mental health, what we mean is that people's core psychological, social, and emotional needs are being met. So there's a core human need for social connection and community. And when we go without connection, it's like going without water for us. It's a basic, we are a social being. And so part of being mentally well is being connected to other people. It's being in community. Part of it is around having a sense of meaning and purpose in your life, right? So when we look at communities in Chicago or around the country, if you see large percentages of communities that say, you know what, I don't feel like my life has a purpose. I don't have a sense of hope about the future. I don't feel like life for my family is going to be better than it was for my parents. That's an indicator to us that a core human need is being unmet there. We are beings that need a sense of meaning and purpose in our lives. We think about safety. We are beings that need a home, that need a sense of safety in the world. And when we feel persistently unsafe, this is something that really compromises our well-being.
And we've seen that during COVID.
We've seen that during COVID.
Real undermining of people, in terms of infectious diseases, feeling unsafe in ways that we had not seen in 100 years.
Absolutely. We think about physical health, too. So there's a really deep interconnection between physical health and mental health. We sometimes think about those as kind of not overlapping, and they very much overlap. That our mental health is we are creatures that are in bodies. We are embodied beings. And so we feel our mental health in our bodies. We feel our emotions in our bodies. And so this graphic that you see emphasizes that mental health really it comprises all of these elements. Our health, a sense of community, purpose, home, And so at the health department, we're not just trying to connect people to therapists or connect people to psychiatrists. We're also trying to think about how do we promote things like connection at the community level. How can we invest in programs that build connection in communities? How do we support safety in communities? How do we make sure that people have affordable housing? So thinking about things like that and their interconnections with mental health. And so I wanted to say that up top because we talk about this as a health department a little bit differently than you somehow hear it talked about in the broader culture. As you know, Dr. Arwady, we've been busy. I think my team is a little bit sleep deprived, so we're probably not taking our own advice. But over the last 3 years, our budget has increased from $12 million in 2019 to almost $90 million, and that has been because of the activism of advocates, the mayor's leadership. She's been incredibly supportive of our efforts. City council members have been incredibly supportive, and you've seen over that time frame. With a $12 million budget, the city was either directly providing services or through partners that we funded services to about 3,500 people. We're anticipating serving 50,000 people this year.
Yeah,
so if you just think about that.
3,500 to 50,000 in those 3 years. I mean, it's remarkable. And that's services.
It's services, which I'll show you a little bit more about in a second. So it hasn't just been that the budget has increased, it's that the budget has increased and we are doing a lot more for a lot more Chicagoans.
And more to go.
And more to come, which we'll talk about. So, one of the things, that we really did initially, that one of our biggest efforts has been funding mental health clinics all around the city. So on this map, you'll see in the dark blue the community areas that we were most concerned about initially because they just didn't have enough mental health clinics. And so we are funding across these communities 35 different community partners, and then we operate 5 of our own clinics. And you see those mapped across the map in Chicago. Through this network, we provided services to almost 30,000 people last year, and then you see different types of services we delivered. About 70% were services for adults, 30% for kids. Kids is 0 to 17 here. And the most common things people were getting through this network is therapy, psychiatry or medications, and then case management. And these services are delivered regardless of health insurance, whether you have health insurance, your ability to pay, your immigration status. And we're really funding and coordinating this effort. What we're about to do is we have a funding opportunity out that's going to then expand our network into all of those light blue communities. And so we're going to have a citywide network that should have more than 50 clinics in it
Because we
this
want
year.
All over the city there to be options for people, even if they are uninsured, even if they are lower income, even if they are, don't have formal immigration paperwork.
That's right.
And there are absolute commitments that where these clinics are joining our network, they're receiving public funding and they are open in that way to all.
That's right. They can't turn people away. And what's been nice about this is we provide some direct services through our own 5 clinics, but we're able to really promote partnerships now between the programs the city directly operates in this much broader network of providers. And that's been really, really critical. As you know, one of the biggest problems in mental health is the system is really complicated. And so this is really about coordinating the system and making it easier for people to get connected to what they need. A second thing we've been working on is our program CARE, which is Crisis Assistance, Response, and Engagement. This is a program where we've integrated mental health professionals into the 911 system. So if you call 911 in 5 communities in Chicago from around 9 to 4:30, you perhaps will be met, if your call is eligible, by a mental health professional, a community paramedic, and a police officer with specialized crisis training that will respond to your 911 call, rather than the normal response, which is normally patrol officers from the police department. So we've started 2 teams, more teams to come this year, and this picture, which I love this picture, is a picture with the mayor and 2 CPS students from the Mayor's Youth Commission who designed our logo for this program. So you'll start seeing this logo across the city on the vehicles that
because the response vehicles, they're not police.
That's right.
Right. Yeah.
These are vans that are much more patient friendly. Yeah. They don't look like a traditional sort of first responder vehicle, and so appreciate these two students who did a beautiful job. And this was a photo with their families and the mayor from about a month ago. So appreciate their artistry. You know, we've also launched a mental health website, mentalhealth.chicago.gov. So you can go to this website and there's a resource finder. All those resources we were talking about are in the resource finder. So if you need services for yourself, for a child, for a family member, a neighbor, you can look them up. You can also call 311 or the NAMI helpline. Those numbers are on the website, and they can also help kind of navigate you. Sometimes it's overwhelming to search for mental health supports, and so you can always just call that number and say, hey, you know, my child you know, is experiencing anxiety. Can you help me get them connected to a provider in our community? And they'll help you get that sorted out. There's also stories of Chicagoans across our city telling stories about their own mental health journey. And that's the point of the Unspoken campaign, is really to encourage people to talk about their mental health stories. I mean, if you think, you know, in your own family, we're usually a lot less shy about talking about, you know, if we have high diabetes or high blood pressure than if, you know, our child has bipolar disorder, or if our aunt is struggling with alcohol use disorder. Those things are often things we kind of keep close to the chest, if you will. And one of the things we know is talking more openly about our experiences helps us feel closer to people. It helps us ask for help when we need it. And so that's part of what we're trying to encourage with the campaign.
All right, great. And I see a number of you already putting in mental health related questions as well as some COVID questions.
Great.
So thank you for that good overview.
Yeah.
Let's jump right in. So Mary Rodriguez on Facebook, where can we find a listing of these clinics and insurance they accept? So maybe just review that piece.
Yeah, thank you, Mary. So if you go to mentalhealth.chicago.gov, there's a resource finder. You can put in your zip code and it will pull up clinics that are close to your community, and will list you know, their phone number, their hours of operation, the languages that they deliver services in. All of the providers that are in that resource finder will deliver services whether you have insurance or not. Yeah. Right? That we are not including things in that database that would turn people away because, say, you don't have Blue Cross Blue Shield health insurance or something like that. These are all providers that have made that commitment, and that is why they're in the resource finder. If for whatever reason you're having difficulty using that resource finder, as I said, or just would like some additional help, there's also you can call 311 or you can call the NAMI helpline, and their information is listed on the resource finder, and they can help you figure out what you need and then get you connected to it.
Yeah, I often find that people really, to your point, it's our health system is unfortunately quite challenging to navigate. And so where somebody is insured, you know, one place that you can look is, you know, literally you can also call the number on the back of your insurance card or look online and see some of that. But we know a lot of people are either not insured or not entirely sure how to use it, et cetera. And to be part of our network, the goal is that you can get connected. And there's some other questions about what exactly, like what kinds of clinics these are and what's in there. Yep. Maybe I'll start there, and then you can add in. So as Matt said, it's a mix of, you know, we continue to operate and actually have been putting a lot of investments into some of the mental health clinics that the city continues to operate. We're offering pediatric child services, you know, starting to do that. We're starting to look at some of the evening hours, but it's a lot about filling in gaps that isn't there. So federally qualified health centers, which are often safety net providers, you know, for people who may be lower income, et cetera, but have more traditionally been focused on physical health. We've been funding to build and grow mental health capacity there. We also have been working with a number of providers that only do mental health services here in Chicago, and to again be able to supplement and grow their offerings, move it out of clinic. And then there have been some really interesting partnerships where, for example, I was talking to Lakeview Pantry the other day, which is an organization that we know well that works on food insecurity, not just in Lakeview, but across the city. But they also, as part of our network, we're actually funding providers, you know, clinicians, social workers who can be doing some of that connection for people who are maybe not coming first and foremost with a mental health health need, but then also have it. So
that's right. So like Lakeview is a good example of a community-based organization where we funded them to add 3 therapists into their program. So if a resident comes to Lakeview who has food insecurity but also is experiencing depression, they can have both needs met there. So that's right. So we really call this the mental health safety net system. This is the system where you go when you need services and you're not going to get turned away.
All right, we have a question here from Carla. I like the way you framed mental health, not just as mental illness, but I feel like there are significant gaps. Sorry, I just hit something. I feel like there are significant gaps in Chicago's mental health system for communities of color.
Mm-hmm. Yeah, so
hold on. What is the city doing to reach people in these communities? And I'll get my window fixed while you answer that question.
Yeah. So Carla, you said? Yeah, thanks, Carla. So I think a really important point. So I think there's a few different things. So the first thing is that, when you look at that map we showed before of the communities in dark blue, those were the communities that we first said we need to really invest resources in those communities, and we need to have more mental health clinics and more staffing in the clinics that are there. And the vast majority of those communities were communities of color. And we did that very intentionally because when we looked at the data, we saw that the safety net was strongest on the north side of the city, and it was weakest actually on the far south side of the city, followed by kind of mid-south and west side. So we really focused our investments initially on the south and west side. And so that's one key part of this. I think a second part of it has been we're really focusing our mental health awareness campaign about how to get connected to those resources, primarily in communities of color, but not exclusively, because we want people to be aware, okay, now that we've funded these resources, here's how you would get connected to them. I think we're also trying to really think in new ways about how to promote mental health. So funding projects at the community level, for instance, that address vacant lots. Addressing programs that try to build social connection in communities, right? And that gets back to my definition, is that promoting mental health is not just about treating a problem, it's about promoting well-being. So anytime you're promoting connection, anytime, like with Invest Southwest, the mayor's economic development program in South and West Side communities, anytime we're building more affordable housing, we are promoting mental health. If we're addressing vacant lots, there's a strong relationship between having lots of vacant, unmanaged land in communities and compromised mental health. That all improves mental health. And so, the mayor has sort of talked about this all hands on deck approach. Yeah. That sometimes we kind of think in silos, like, oh, it's the health department's problem to figure out mental health. It's the police department's problem to figure out public safety. It's kind of all of our responsibilities to work on these issues.
Yeah, I also think, one thing that I have been particularly proud of during COVID is that we've seen a lot of pivots in how we think about delivering health services. Mm-hmm. And I think we've especially seen that in mental health, where we had already been working to have more access to things like telehealth. We'd been thinking about how do we use some of the technology that a lot of the kids, are often using to build connection there. And we've been thinking a lot about how to get mental health resources, and not just absence of mental illness, out of clinic walls. So this work to sort of decrease, because there still can be a lot of stigma for people still, in terms of seeking mental health resources. And I don't know, that's been some of the part I've been the most interested in. We're funding and directly doing work that brings care, especially to people, because sometimes people who do have more serious mental illness, if they're not on good treatment, they're actually not that likely to sort of be keeping a 10 a.m. appointment on a Tuesday in a mental health clinic, and thinking about how do we bring resources to them, especially if there's overlap with people who are also experiencing homelessness or have an underlying substance use disorder. And I think when I think about sort of our role as a public health department in the larger sort of mental health and physical health system, often it's about where are their gaps, where are their needs, and where are there less traditional ways of making sure people can access health who are not the ones already going to, you know, outpatient clinic appointments. So that's been, I've really appreciated that focus.
Yeah, I think that's a really important point, that clinics are important, but they are not sufficient in terms of having a comprehensive strategy. So you have to have teams that go outside the walls of clinics. You have to have mobile mental health units that can deliver services off of the unit in the community. We have to have telehealth. We added telehealth at our own clinics. 25%-ish of our services are now delivered via telehealth, right? So, and we've heard over and over again from providers that they're seeing that patients are much less likely to miss their appointments when they have that telehealth option. Because, you know, if you have children, if you have, you know, other, professional, work schedule things that preclude you from, you know, getting in your car, riding the train, and going to an appointment, you know, those telehealth encounters can really make it a lot easier.
Yeah, and the particularly, you know, the question, you didn't mention this, but on the question about sort of reaching communities of color, we're also really interested in, for all kinds of healthcare, having the providers reflect the community more, right? So more Black, Latinx, Asian providers in mental health, and where we think about sort of that connection for background, but also for things like language, telehealth becomes particularly important, because if you have, a clinician who is a native Polish speaker, for example, you're not going to have that everywhere all over town. But if you have a patient who needs Polish,
that's right,
you know, on the south side at this moment, on the north side at this moment, you can think better about how you connect people using some of that new technology. And telehealth is not for everybody. And of course, we continue the clinics. But it's been really, I think, helpful to fill in some of those gaps where we're thinking about trying to match people to clinicians that they feel comfortable with.
I think that's a really good point.
So anyway.
And I think before COVID, you know, we started a telehealth program in our own clinics in 2019, and there was some pushback.
Yes.
There was some discomfort, and I think during COVID we all got used to, you know, connecting in new ways, and I think now, I think there's much greater openness to it.
All right, there's one nice question here that's a little bit of a bridge between mental health and COVID, so we'll do that one. We'll take a few COVID questions and then sort of go from there. So Kristen Korkowski on Facebook, it's a good question, says, COVID forces us into social isolation at times. Any tips for someone who doesn't handle isolation well? I felt trapped a lot in the beginning of the pandemic.
Yeah, thank you, Kristen. That's a great question. And that's one of the things we probably saw most commonly on the mental health surveys in Chicago and around the country, was that people were reporting high levels of loneliness and social isolation, and then stress connected to that, anxiety connected to that, depression connected to that. Again, think about it. Connecting is a core human need, like eating, right? So if the need is not getting met, we start to have an adverse reaction. It affects our mood. We might feel it in our body. So I think, you know, things that we've talked a lot about is the importance of getting out of your house.
Yes.
Going for a walk, getting exercise, connecting with people outside of your house.
Life is better with other people in it.
That's right. And physical exercise naturally improves our mental health. Like it's an evidence-based thing for anxiety and depression, actually, is getting physical exercise. I think a second thing is, you know, really trying to think about what does digital community look like when you have to be inside. People did so many creative things during the pandemic, around digital community, and I realize it can be difficult, but really trying to frame it to yourself as an opportunity to try to connect in new ways. A third thing to remember is that connection, and we know this from the research, is not about primarily the quantity of connections we have. It's about the quality of connections, right? So you can have one person who can have 20 friends and they can feel lonely because the quality of those relationships is not meeting their need. You could have a person who has one friend and they could feel socially connected. So think about in your own life, how are you improving the quality of connection that you have? You know, maybe within your bubble, you know, and I hope we don't get back to a point where we need to have bubbles, but I had a bubble during the pandemic that had 4 people in it, right? And that was incredibly life-giving for me, right? And I know others have done the same. So remember that quality-quantity piece around social connection.
Great. All right, we'll take a couple of these COVID questions and then sort of go back and forth. So there's a couple of questions here about masking in schools. So Darcel Rocket on Facebook says, any news of possible mandatory masking for schools, with Chicago more than likely turning from low to medium this week or next? And then Mindful Monkeys on Twitter says, given the explosion of cases at several area elementary schools, is there a plan to bring masks back to protect our children from liver failure, heart problems, etc.? The surge is becoming more difficult to hide every day. So we're not hiding the surge for sure, but thank you both for those questions. So let me talk through what this would look like. So I do anticipate, and I'm glad people are asking it in this way, that we probably will turn from low to medium risk. However, we are currently only planning to put mask requirements in place at a high risk level. I always put a little caveat on that. I say, if we were to get, a new variant of concern emerging, if we were to see a major change in viral transmission dynamics, we may need to be more conservative. But in the absence of that, assuming that COVID continues to behave in the way that it has been behaving, we would not mandate masking or mandate vaccine for high-risk settings unless we were at a high level per CDC. But at medium, you will see more signs. For example, these are the mask strongly recommended indoors signs that, if you've been looking at the city signs in green where we've been, they generally say mask optional and then, encourage people to be kind and to wear masks, especially if they're having symptoms. But as we move into a medium risk level, you will see more of this. Masks strongly recommended indoors. And I would ask you, and I personally will be putting my mask back on more. We are not at red. Red, masks required indoors. And that will also be true in schools. It is possible that we may see individual schools, businesses decide to be more conservative. Individual settings can require masking, but I know that the great majority, Chicago Public Schools included, are planning to follow the city guidance where masks will be strongly recommended indoors when we move into that yellow or medium risk. We are stepping up surveillance. We are working on more things. The goal is not to get back to this point, but if we got into trouble, we would do this in a required kind of way. So when we get into medium, for me, it's like a yellow traffic light a little bit. It says cases are going up. Nothing that is of huge alarm, but there is more risk when you are out and about. Thank goodness our hospitalizations and deaths are as low as they are, but nevertheless, there's more chance that if you are in a large gathering of people, especially if you don't know vaccination status, somebody may have COVID. And so I want people to understand when that risk goes up, you want to be a little more careful. So that's kind of the idea of it. And thank you both for those questions. All right, let me get a couple other COVID questions, and then we'll get some more mental health ones. So there's Elena Levy on Facebook has a couple of pretty quick ones here. She's wondering, is the at-home Chicago, Protect Chicago at Home, giving Moderna vaccines? At this time, no. We are only doing Pfizer, partly because Pfizer is the vaccine that is available sort of to all ages and all boosters, et cetera. So we actually have never done Moderna through Protect Chicago at Home, not because it's not possible, but just because we're trying to sort of balance efficiency and cost and et cetera. I will say, though, and a few of you have written about what's happening with the younger kids, that if Moderna were to be the first vaccine approved for children under 5, we absolutely would at CDPH make that part of our repertoire, whether that's in sort of our clinics, in our temporary vaccine sites, through Protect Chicago at Home, et cetera. So right now, it is Pfizer that we continue to offer first dose, second dose, first booster, second booster. But Moderna is widely available at pharmacies, at some pop-up events, and there will continue to be calendars if you go on the website about that, or through your healthcare provider. Good question. And then Elena also asked, she said, I received a text from the CDC system that it's time for my next booster. I'm only 40. Am I eligible for a 4th dose? So this makes me wonder, Elena, a couple of things. One is that there are a number of various texts that are coming. So if this is from, if you were part of the system that you were putting in your safety data and reporting that out, and that's where it's coming. It's interesting to me that you're getting it if you're only 40, because you're not eligible for a fourth booster. You don't need a fourth booster if you are only 40. I will note, though, that at the state level, the Illinois Department of Public Health has also been doing some texting to reach out to people who, per state records, maybe haven't had that first booster or maybe are missing that second booster. And so if this text was from the state, it could be like if you got one of your vaccines out of state, or maybe there was a difference in the way you're, a typo in your name or something, that it's possible that one of your boosters or your booster is not being recorded. So I would encourage you, if you're curious about it, you can log in. There's information on our website for how to do this. You can actually look and see what's in the state system. But no, if you're only 40, you do not need to get a fourth booster or a fourth vaccine shot. I am under 50 and have not had a fourth vaccine shot myself, and that is a very good question. But otherwise, for most people, if you've not had a booster, if you're over 12 and it's time, as we potentially move into medium risk, it's the number one thing I'd like people to do, to have everybody in their households, in their networks, be up to date with vaccine. And yes, that includes a booster. That third dose, especially important with Omicron. That's what we saw. Okay. And Peter Puccillo is asking, at what point would a second booster be available to everyone? So I don't 100% know on this. It all depends on CDC and FDA. But here's what I anticipate will happen. I anticipate that we may see an updated version of COVID vaccines potentially sort of this fall, ahead of the winter surge. And by updated, I mean probably the same providers, but made to more specifically work against Omicron and Delta and some of the changes that we've seen. We've been incredibly lucky that those original vaccines that were made, which of course were designed against the original version of COVID before all of these variants, they have continued to work amazingly well at protecting people from severe outcomes, hospitalization, death. They also continue to protect people against infection, but that protection has not been as good as we've seen more variants come. So I am anticipating that we may see, depending what happens with COVID over these next few months, and the health department is planning, we may see in the fall, we're getting ready in case we're at a point where everybody is recommended to sort of get another booster, but with that updated version of the vaccine. It may be something where we're doing a flu, right? We make a different flu vaccine every year based on strains of flu. We may be in the fall encouraging everybody to get their flu booster and get their COVID booster, But at that point, that is all premature. That is just me speculating. The reason the recommendations were made for the fourth dose for people who are over 50, especially if they have underlying conditions, is because we know that some of that protection wanes, especially against infection. And at a time when COVID cases are going up, masks start working as soon as you put them on. So, when we switch to masks being strongly recommended indoors, we see some more masking. We expect to see that impact pretty directly. There's protection for yourself. There's protection for others. Vaccines, though, take time to kick in. They take time to distribute. Right. And so if you're in a significant surge, it's not the best time to kind of be trying to vaccinate everybody. So for the highest risk people, it does give you some additional protection. So thanks for people asking that. All right. One more COVID, if you don't mind.
Sure.
Jeanette Barcelos Kravitz on Facebook, because I like this question. What is the advantage of taking the prescription pills once diagnosed with COVID versus over-the-counter drugs? All right, Jeanette, this is a great question. So just to make sure everybody knows what you're asking about, there are now really new, for the most part, this calendar year. They were in very, very short supply late in 2021, but really they're available for the first time in a serious way in 2022. There are two versions of prescription medications that are designed for people who have been diagnosed with COVID. So it doesn't matter if you've been vaccinated before or not. If you are diagnosed with COVID and you're high risk for getting really sick, for getting hospitalized or dying, meaning you have underlying conditions. By definition, anybody over 65 is eligible, and any age is eligible, including now children, if they have serious underlying conditions. If you get diagnosed with COVID, these two versions of the prescription pills, the one that has the best data is one called Paxlovid that Pfizer is making. Those have been shown in trials to cut the risk of hospitalization by more than 80%. So they're incredibly effective. I think of those pills as belt and suspenders with the vaccine. We want everybody to get vaccinated. That's the most important thing. But if you get a breakthrough infection, or if somebody has not been vaccinated and they get COVID, if somebody's at higher risk, we really want you to take those prescription medications. The over-the-counter medications that are helpful are the ones that I think of as being for supportive care. So certainly, if you're otherwise young and healthy and there aren't significant concerns, taking Tylenol, taking ibuprofen, those help bring down fevers, they help decrease muscle aches, they help people feel more comfortable. But we do not have evidence for some of those other medications. So, for example, there's been, you'll know, there's been a lot of conversations about some of the things like ivermectin, right? There have been large studies actually showing that ivermectin was not helpful when they did the large studies at helping keep people out of the hospital or making them less sick. That one's not an over-the-counter, but you get my point. So if somebody has serious underlying conditions, we want them to get these treatments. And there are prescription and there are IV treatments. So if you go to our website, you can find information about it, but you got to see a doctor to get these treatments. You can't just get them. You have to have a prescription. And you can always call our line if you need help with that. Okay, let's go back and do a few more mental health ones. So here's a good question on Facebook. How do we request the mental health response team when calling 911? I know we've asked for CIT trained officers for 911 calls related to mental health crises before. And then this is Mary also asking, is there specific jargon to request the mental health response teams? Can you just talk a little bit about that?
Yeah, Mary, you said?
Mary is her name.
Yeah, thanks, Mary. So we have two teams, as I mentioned. One is in Lakeview, North Center, Uptown area, and then we have another team that works in Auburn, Gresham, and Chatham on the south side. We have two more teams that are starting this year, one on the southwest side, one on the west side. So if you live in one of the communities that I mentioned, and it's during sort of broadly the hours of 10 to 4, you would call 911. And you can request a care team. You can explain the call. You can say, would it be possible for you to send a care team? The call takers will make sure it's appropriate to the care team, and if it's appropriate call for them, they will send the care team. The other thing you can do...
Can I just add one thing to that? You don't have to request the care team, though. If you live in one of those areas and you call, and the primary reason you are calling is because somebody is having a mental health crisis, they'll do some screening questions, but you would automatically get the care team dispatched. Just
that's an important point. Residents, it's our job to figure out whether care is appropriate for you, and so we will determine that whether you are accosted or not, but you can always request it. The other thing is what you said in your question, is that if a care team's unavailable, you can request a CIT officer.
What's CIT?
Crisis Intervention Team, and so these are police officers that have specialized mental health crisis training. They are on the police side of things, they are the group that we try to prioritize if a care team is unavailable to respond to a call.
All right, good. And then a couple just follow-ups on that. How does the 911 center distinguish if the care team should be the ones responding to a call? And when will the care team expand to later hours or more communities?
Great question. So the things we're really looking for as to whether the call's eligible for us is we basically are ruling out calls because of safety concerns. For instance, if a person has a weapon, and if there's a medical emergency that requires somebody to be emergently taken to an emergency department in an ambulance. Those are kind of the primary reasons a call would not be eligible. So the call takers screen for that, and then if they don't see those elements being present and the call is a mental health call, they'll send it to us. We are looking to expand 2 more teams, one on the southwest side in a group of communities, and one in the Garfield Park, Humboldt Park area later this summer on the west side. I do think as we move forward, we're going to be looking at expanding shifts as well into that second shift, because I think what we've seen from other cities is if your team's out in the community 12 to 16 hours, you have 2 different teams. that really helps build awareness and people start to use it more.
All right, and we're just about at time. Carrie Beers Cook asked, how are you planning to provide more accurate and transparent data about COVID infection and spread in school or child care settings? I've had the experience of my child's classroom having a case of COVID. We didn't get informed. My child is vaccinated, wears a mask, and says, since we're approaching it as a personal risk issue, how can I make decisions without better data? So this is a good question. First of all, on the city's website, you are able to break all of the data down by age. So if you want to see across the whole city, what are we seeing for cases, for hospitalizations, for deaths, for transmission, zip code, age, etc., that's for the whole city. Individual schools and school districts and school systems also do their own COVID tracking. So I don't know what school your child is in. Chicago Public Schools, for example, though, we've worked closely with them. There is a dashboard specific to Chicago Public Schools that also gets updated multiple times a week that you are able to look. And, we trade that information back and forth. Of course, my team is looking at this, so I know what the positivity has been in Chicago Public Schools. And anytime there is an outbreak setting, Chicago Department of Public Health is involved, and we work to sort of make sure that that's there. Your school is expected to have notification procedures when there has been a close contact. So I don't know the details of which school you were at, et cetera, but I would, if you have not already done this, I would make it, just reach to your school and be like, I was really concerned about this. Like, I expect to be notified, and that is the protocol really at schools, that when there is a COVID case identified and someone has potentially been in close contact, even if the child is not needing a quarantine, if they're masked, vaccinated, et cetera, you should still be getting notified. And I know that is the protocol within most of our schools here. So I hope that sort of differentiated. The health department is about the whole city and youth, and then any individual school or school district makes its data available and should be being transparent about that. Okay, I think we are almost at time here. Yeah, we're at noon. Maybe the last question. Mary Rodriguez is asking a lot of questions.
Oh,
so she's wondering if she said she's seen that the SAMHSA and Lifeline is going to initiate the 988 suicide hotline number starting in July 16. Does this seem like it will be on track to start then? Maybe just to kind of finish things off, why don't we talk a little bit about 988?
Yeah.
Because a lot of people probably don't know about it. And then we'll wrap up.
Yeah. Thanks, Mary. I'm glad you asked about that. So there's something that is called the National Suicide Prevention Helpline that folks may be familiar with. So it's a number you can call or that you can text around the United States, and it's if a person is experiencing a crisis, often related to suicidality or being suicidal, but not always, and you could talk to somebody over the phone who would try to, determine, whether they could help you over the phone, whether you needed to go to the emergency room or get connected to a mental health provider in the community. That line, in July of this year, is becoming 988. It's going to become a 3-digit
all over the country.
Yeah, all over the United States mental health crisis line. So no matter where in the United States you are, if you call 988, your call will go to a mental health call center in your state, ideally, who will assist you in helping you get what you need. And what the federal government is telling us is that they are on track for that to be up and running this July. I think this is something over time that will get more and more sophisticated. The goal is to get to a point where it's not just a helpline. They can also dispatch, mental health providers that could come to your house or could come to your place of work if they think that you need to be evaluated in person. We are working very closely with the state on 988 implementation. We want it to be successful. There are lots of mental health calls that I think are actually a better fit for 988 than for 911. There are many calls that I think are better for 911, and we're kind of sorting that out right now. But I think it's a really, really important program and something that the United States has needed for a long time.
Absolutely. All right, we are at time. A few of you were asking about substance use, and we will be doing separate conversations about work in substance use because there is a lot happening in that space too. But I really want to thank Matt Richards, our Deputy Commissioner at the Chicago Department of Public Health for behavioral health. He and his team have been working, they always work a lot, but over these last few years with the way COVID has hit and recognizing the mental health impacts of that on top of an already stretched system. I'm so thrilled that there have been major investments and major growth and a huge increase in the number of Chicagoans, especially higher need Chicagoans, getting connected to high quality mental health care. We have a long way to go still, but I think this systems work has been essential, and I'm really proud of it. And we're excited to expand it some more. I wish you a happy Mental Health Awareness Month. You'll be seeing some more news and announcements over this month as we continue to share out some of the work that we're doing and some of the gaps that we're still working to fill here in Chicago. So thank you very much for your attention. And we will be back next Tuesday for our regular Facebook Live at 11 a.m. If we move to medium risk in the meantime, it could be as soon as this Friday. That is not a cause for panic. That is a cause for increased awareness, more wearing of masks indoors. And of course on Tuesday, if we've moved by that point, we'll talk some more about it. But you know, it's the moment to pull that mask back out a little bit. Doesn't mean at all points, at all moments, it's not requirements. The sky is not falling. But we want to keep us in reasonably good control. New York City moved into medium risk earlier this week. Washington, D.C. did a couple weeks ago. Seattle. You know, we're seeing a number of cities looking just like us in terms of often starting in the suburbs and then kind of moving in and not seeing the severe illness. You know, if COVID had showed up initially killing an average of 0 people a day, we would not have needed to do all of the dramatic things that we've done over the last 2 years. So keep in mind, we are in such a different place than we are 2 years ago, but we want to be, if we move into medium, a little bit more careful to help keep those transmission numbers in good control. And we're going to have a good spring and summer. I'm feeling very optimistic still. We're nowhere near high, and I don't anticipate it coming soon. So thank you so much for your attention, your excellent questions, and we'll do some more mental health, substance use lifting up over this month. So if we didn't get to your question today, rest assured there will be additional opportunities for both COVID and non-COVID or indirect effects of COVID next week and in the weeks to come. Thanks so much.
Thanks. Bye-bye.